How to strengthen your lungs after illness, natural lung recovery tips. Hey there, Wellness Pulse family. Welcome back to your go-to space for trusted, science-backed health information tailored for you and your loved ones. If you're new here, don't forget to hit that subscribe button so you never miss another episode on staying well, healing naturally, and living your healthiest life. Now let me start by asking you something important. Have you recently recovered from a respiratory illness, maybe COVID-19, pneumonia, bronchitis, or even a nasty flu that left your lungs feeling weaker than usual? Are you still experiencing shortness of breath, chest tightness, or that lingering feeling like you just can't quite take a deep, satisfying breath? If you nodded yes, you're not alone. Right now, thousands of people across the USA, UK, Canada, and honestly, around the world, are asking the same questions. How do I rebuild my lung strength after being sick? Will I ever breathe easily again? Is there anything natural I can do at home to help my lungs heal faster? The great news? Yes, there absolutely is. And today, we're diving deep into natural lung recovery strategies that are both safe and backed by science. Stick with me till the end because I'll also share surprising lifestyle tweaks that many people overlook, but that can make a world of difference for your lung health. Let's get started. Understanding what happens to your lungs after illness. First, let's understand why your lungs feel so off after an illness. When you battle a respiratory infection, your airways and lung tissues often become inflamed. Think of it like this: imagine your lungs are like a sponge. During illness, that sponge gets swollen, irritated, and sometimes even clogged with extra mucus. Even after the infection clears, the lingering inflammation can make it harder for oxygen to move efficiently from your lungs into your bloodstream. That's why so many people feel breathless or weak even weeks after they're technically better. For illnesses like COVID-19, the effect on your lungs can be even more intense. In some cases, there's damage to the tiny air sacs called alveoli where oxygen and carbon dioxide exchange happens. But here's the hopeful part. Our lungs are remarkably resilient. With the right support, care, and time, they can regenerate, rebuild strength, and function more efficiently again. So, what can you do to help that process along? Step 1: Mastering the art of deep breathing. Let's start with something simple but powerful: breathing exercises. Now, I know what you're thinking. Breathing? Really? Isn't that automatic? Yes, it is. But intentional, controlled breathing exercises can retrain your lungs and diaphragm to work more effectively. One of the best? Diaphragmatic breathing, also called belly breathing. Here's how you do it. Lie down or sit comfortably. Place one hand on your chest and the other on your belly. Breathe in deeply through your nose, letting your belly expand while keeping your chest still. Then slowly exhale through your mouth. Do this for 5 to 10 minutes, 2 or 3 times a day. Why does this help? Because it encourages your lungs to fill more completely, improves oxygen exchange, and reduces breathlessness. Another great option? Pursed lip breathing. Inhale deeply through your nose, then exhale slowly through pursed lips, like you're blowing out a candle. This helps keep your airways open longer, making it easier to get stale air out and fresh air in. Step 2: Get moving, even if it's just a little. After being sick, it's normal to feel tired or weak. But gentle physical activity is one of the best ways to rebuild lung capacity. Start small. A short walk around your living room or down the driveway is a great first step. Gradually build up to longer walks outdoors if you can. Why does movement matter? When you move, your breathing rate increases, challenging your lungs to work a little harder. This gently strengthens both your respiratory muscles and improves oxygen efficiency. And here's something fascinating. According to studies from organizations like the British Lung Foundation and the American Lung Association, even light aerobic activity can improve lung function and reduce feelings of breathlessness in recovering patients. So next time you hesitate, remember, even a 5-minute stroll is a win. Step 3: Support your lungs with lung-loving foods. You've probably heard the saying, you are what you eat. Well, when it comes to lung recovery, that couldn't be more true. Some foods are natural anti-inflammatories and rich in antioxidants, 2 things your lungs desperately need right now. Here's what research says can help. Leafy greens like spinach and kale, packed with vitamins A, C, and E, which help combat oxidative stress in lung tissues. Berries, especially blueberries, loaded with anthocyanins, compounds known for their lung protective effects. Fatty fish like salmon and mackerel, full of omega-3 fatty acids that help reduce lung inflammation. Ginger and turmeric, both have natural anti-inflammatory properties. Try making a warm ginger turmeric tea for soothing benefits. Garlic and onions, these contain compounds that help fight infections and support immune health. And of course, water. Staying hydrated helps thin mucus in the lungs, making it easier to clear out. Small diet changes, big lung benefits. Step 4. Clear your airways, naturally. If you're still dealing with lingering mucus or phlegm, here's a natural technique to help. Steam inhalation is simple and effective. Boil water, pour it into a bowl, and lean over with a towel covering your head. Breathe in the steam for 5 to 10 minutes. Adding a few drops of eucalyptus oil or peppermint oil can enhance the effect. Both contain menthol, which can help open airways and loosen mucus. Another great tool? Controlled coughing techniques. This isn't about random coughing. It's about deliberate, gentle coughs to help move mucus up without straining your lungs. Here's how. Take a slow, deep breath. Hold it for a second or two. Then, with your mouth slightly open, produce 2 to 3 sharp coughs from your diaphragm. Step 5. Prioritize restful sleep. Your lungs heal overnight. Believe it or not, sleep plays a massive role in lung recovery. During deep sleep phases, your body enters repair mode, reducing inflammation and restoring damaged tissues, including those in your lungs. Try sleeping with your upper body slightly elevated if you're still experiencing congestion or breathlessness at night. Also, keep your bedroom air clean. Use an air purifier if you can, or at least make sure your space is dust-free and well ventilated. For those in cities across the USA, UK, or Canada where pollution levels may spike, keeping windows closed during high pollution days might also help. Step 6. Practice lung hygiene every day. Lung hygiene? Yep, it's a thing. This means taking small daily actions that reduce further stress on your lungs. Avoid exposure to smoke, whether it's cigarette smoke, fireplace smoke, or even heavy vehicle exhaust. Stay away from strong chemical cleaners and aerosols whenever possible. On days with poor air quality, especially in urban areas like London, New York, or Toronto, try to stay indoors or wear a mask when outside. Also, don't forget to wash your hands regularly. Why? Because preventing new respiratory infections is crucial when you're already in recovery mode. Step 7. Consider breathing gadgets, with medical guidance. In some cases, especially after more severe illnesses, doctors may recommend using simple devices like incentive spirometers or PEP, positive expiratory pressure devices. These tools help you practice deep breathing and improve lung expansion. If you're curious about these, chat with your doctor or respiratory therapist. They'll let you know if it's right for your situation. Step 8. Reduce stress. It impacts your breathing more than you think. Here's something people often overlook. Stress and anxiety can actually make breathlessness worse. When you're anxious, your breathing becomes shallow and rapid, putting extra strain on already healing lungs. Try calming practices like meditation, gentle yoga, progressive muscle relaxation. Even just sitting quietly and focusing on slow, steady breaths. Apps like Calm, Headspace, or even simple YouTube breathing tutorials can be a huge help. Extra tips, things you didn't know your lungs would love. Before we wrap up, here are a few extra, research-backed lung recovery hacks you may not have heard. 1. Singing and humming. Studies show that controlled vocal exercises like singing can strengthen respiratory muscles and improve lung capacity over time. 2. Laughing more. Yep, laughter is like internal jogging for your lungs. It forces more air out and stimulates better airflow. 3. Stay up to date on vaccinations. Flu shots, pneumonia vaccines, and COVID boosters where recommended, all help reduce your risk of future lung infections. 4. Spend time outdoors, when air quality allows. Fresh air, especially in green spaces, supports respiratory health. Just be mindful of pollen or pollution days. Addressing common questions you might have right now. How long will it take for my lungs to fully recover? Great question. It varies. Mild illnesses? You may feel back to normal in a couple of weeks. More severe infections like pneumonia or COVID-19? It might take several months. Be patient with yourself. Should I take supplements like vitamin D, C, or zinc? If your doctor recommends it. Yes. These can support immune function, but always check before starting new supplements. When should I worry and see a doctor again? If you're experiencing worsening breathlessness, chest pain, high fever, or ongoing low oxygen levels, please don't wait. Get medical help right away. Final thoughts: your lungs are stronger than you think. Recovery might feel slow, and some days may be harder than others. But here's what I want you to remember. Your body is healing, your lungs are adapting, and every small step you take matters. Whether it's practicing deep breathing, going for that short walk, sipping on lung-supportive herbal tea, or simply getting a good night's rest, you're moving in the right direction. And hey, this isn't a journey you're walking alone. We at Wellness Pulse are right here with you. If this video helped you or gave you hope, please hit that like button, share your experiences in the comments below, and don't forget to subscribe for more natural health tips, wellness guides, and evidence-based strategies for living your healthiest life.